Hi everyone, it's Dr. Shirlea North from North Star Physical Therapy. And again, I want to thank all of those who have been following me. It's incredible how much this little podcast has spread. So I'm very excited to continue it. And please feel free to reach out if you have any comments or feedback or any questions that you want to have answered. So this episode, we are going to focus on my kind of Venn diagram of specialties, my connection between lipedema, lymphedema, and pelvic health. Those are my two specialties that I really have a passion for treating. I'm a physical therapist by trade, so yes, I know orthopedic injuries, low back pain, hip pain, shoulder, neck, knee, feet, like all those kind of things, and what to do to treat that. But I really have received not only just a lot of education, but also a lot of clinical experience within the lipedema, lymphedema world, as you can certainly look up other podcasts on that, but then also within pelvic health and the same thing. But this episode, I really wanted to focus on how do those really come together, right? So I often say a lot of these things to my clients on a daily basis, and I'm like, why don't I just make a podcast episode about that? Let's go back to what are the main functions of the pelvic floor. And I'm referring to the muscles themselves in that area. And yes, all bodies have a pelvic floor, have pelvic muscles that do a number of things, okay? Those muscles not only are in those born with a vagina, they're also in those born with a penis. They are in children, in teenagers, in adults, in the elderly, okay? Every body has a pelvis and every body has muscles there that serve a lot of purpose. So quickly, those functions are, they support bladder function, so your ability to urinate and not leak. They also help with frequency and urgency, things like that. Those muscles help with bowel function, so for the ability to evacuate or have a poop and not be constipated or even fecal leakage. They also help to stabilize the pelvic bones themselves. They also help to support the pelvic organs, right? So your bladder, your rectum, if you have a vagina, a uterus, you have a prostate, right? So any of that in the small intestines, as well. So they help support those organs from the bottom. They also help with sexual function. So again, no matter what anatomy you are born with in terms of organs and soft tissue, they help for the pleasure aspect. They're one of the only sets of muscles besides your cardiac and your heart muscles that have a very uniquely innervation from the automatic nervous system, the autonomic nervous system for pleasure, right? But that can also be a different podcast related to the nervous system to pelvic health. But they do support sexual function. So we want to make sure we're not having pain with any kind of penetration. If you are the penetrator versus the penetratee, right? We want to make sure that's all functioning well with no pain. And then also the ability for those that do childbearing, that is supporting that reproductive function there too. And lastly, they also help with becoming that muscle pump action for lymphatic flow. So, light bulb moment, that is the connection between lymphedema, lymph system, and your pelvis and pelvic floor muscles. They quite literally act as a muscle pump to help decongest the pelvic area. And so it is insanely important to make sure that the lymphatic flow is happening. There isn't any congestion within the pelvis. There are hundreds of lymph nodes within the abdominal cavity in the trunk, and they are superficial or right underneath the skin, and also deep, like by the organs and within the pelvic cavity itself. And these lymph nodes help to filter out any extra fluid, help filter out any digestive fluid that the small and large intestines, as they're absorbing things of what we're eating. They also help with maintaining that appropriate flow of fluid when, if those that do become pregnant, there is a fluid overload in the entire body, and your lymphatic system feels that. And then especially within the pelvic area, that's exactly where everything is happening, right? So we want to make sure there is a lot of appropriate flow of the lymphatic fluid. So where I really combine these things is when I often am the first provider for those that are looking for a confirmation of diagnoses or for conservative management of lipedema and also lymphedema as well. And I will always screen any pelvic health issues, because that's often, number one, a holistic approach. And number two, you're more than just your lymphatic system and some abnormal fat deposits that were laid down in your body that gets confused from cellulite. And we also have these other things. So this is a bit of a spiel that I tell a lot of folks that are coming in to see me for conservative management for lipedema. Within my program, I quite literally let them know and that I'm going to screen out for these other things, because the research isn't quite there yet, but we are often clinically seeing a lot of common signs and symptoms of other things that are associated with lipedema. For example, there are different kinds of connective tissues throughout our body. They are found within the lining of like blood vessels and veins. They're also found with like ligaments and tendons within our joints. And they're also found within the lymphatic system, like the lining of the lymphatic vessels and lymph nodes too. So all this connective tissue is potentially altered with those with lipedema, especially those with a higher stage or more severe lipedema. We often are checking the boxes of other potential symptoms that they may not have realized. So we know the symptoms of lipedema are these very hard, palpable nodules that are like marbles underneath your skin. And for some folks, those lipomas can grow pretty large, and that's more like Derkham's disease. But they are often starting at adolescence. There's often a genetic component. They can be very painful. They can also potentially limit your ability to stand and sit because you're getting squished and you can't fit into clothes. And it often happens in women because we're finding also that there is a potential hormonal factor in that, because we get it upon adolescence, potentially within pregnancy, as well as right around menopause. So what happens there's a lot of haywire of your hormones during those times of our lives. And so there's this abnormal deposit of these really fibrotic adipose tissue that, unfortunately, there's a lot of medical gaslighting out there that women are just being told they're fat and they need to exercise and they need to diet, or those that go get bariatric surgery and nothing really changed. And so that's just a whole other day to spend on that medical gaslighting nonsense. But I'm also saying, hey, lipedema is really more of a connective tissue dysfunction. And where are these other connective tissues? Like I just mentioned, it's in ligaments, it's in tendons. So if someone is really hypermobile, they're like double jointed, they're super flexible, even though they have these really large legs, for example, these large hips, saddlebags, they have cuffing around the knee or around the ankle, but they're incredibly flexible though for the size that the bottom half is. Like, wow, you can really move and do all these things. It's probably the lipedema, and wow, you're really hypermobile. So we often see folks get diagnosed with Ehlers-Danlos or hypermobility syndrome and lipedema. What's the common denominator there? It's a connective tissue dysfunction. We often see a lot of easily bruising as well. And so there is a connective tissue common denominator with the valves of the veins and the vein tissue and this laying down of this adipose tissue as well. That's not cellulite. Cellulite is much deeper. The lipomas I'm talking about with lipedema is right underneath the skin. It's at the surface. That's why they hurt. They're very painful. And so the connection with the soft tissue and with the connective tissue, especially with the ligaments and tendons, if someone also has hypermobility, they may also have pelvic health issues. If we go back to those functions we were talking about with the pelvic bones, well, ligaments connect bone to bone. So if those ligaments are really flexible, they have a lot of laxity to them, then they're not going to be as stable. What compensates for that? That's the pelvic floor muscles that are in between and around those bones within the pelvis. It's quite literally like a bowl. And I like to give an image of a trampoline. So the frame of the trampoline are the pelvic bones. And that frame is cattywampus because the springs that hold the mesh of the trampoline material to the frame, those springs are ligaments and tendons. If those springs are super like loosey-goosey, the muscles, the mesh is going to try to compensate and try to be really taut. So oftentimes, any kind of tight muscle like that, especially within the pelvis, we often see urinary issues, whether that's leakage or tightness. There might be some urgency and frequency because those muscles are so tight, they're sending the wrong signal like up to the brain for like bladder when the bladder expands and it's getting pushed against those tight muscles. The bladder's, hey, I gotta go. I don't know what's going on. I can't expand as much, so I must empty. So oftentimes I see that. Oftentimes leakage isn't always a weak pelvic floor. It could be a very tight pelvic floor because the muscles are trying to compensate for the loosey-goosey ligaments that are happening because they're hypermobile. So you see how like it all connects together. I often also see folks that are maybe constipated, or they could also have fecal leakage because of the hypermobility of the pelvic joints and pelvic bones because of the ligaments are loosey-goosey and the muscles are trying to compensate. So I hear the comment like, yeah, it's really hard for me to fully empty either my bladder or my bowel. Or then they have sexual dysfunction, like they have vaginismus or pain in right around like the opening in the vulva there. So vestibulitis or vulvodynia, or they also have what's called dyspareunia, like pain with sex. They could also maybe have pain with orgasm. They could have pain with penetration, not just during sex, but also maybe if there's a menstrual device, a tampon, a cup, a disc that they're trying to insert, or during pelvic exams, right? So it isn't all about the penetrative sex, even though that's wonderful and needs to be pain-free and pleasurable. But there are organs there that providers need to be able to check as well. And if we can't tolerate that pelvic exam, what else is going on there? So we've got to check out those muscles to see if they're tight. Or if someone is pregnant and they're laboring, those muscles need to be strong and flexible. So if they're really taut because they're trying to keep the pelvic bones together because the ligaments are too loosey-goosey, you can best believe it's going to be really hard for that person to really labor without any like higher risk of tearing in the area to try to get through that wall, so to speak, of the pelvic floor muscles because they're just so tight. I often also feel like, they have a lot of hip pain and low back pain, and they may be seen like an orthopedic PT. No one's really checked out that middle area in the pelvis. And wow, all these muscles are connected to the inside of these bones, and that pain is being referred to the hip, to the low back, but also these connective tissues all have those attachment sites are all very similar and around each other. So if the ligament and tendons connect muscle to bone, if those ligaments and tendons are really flexible and loose and the muscles are trying to compensate, there's going to be referred pain in other places. But people have got to take a step back and look at the full picture. And that's oftentimes where I am connecting the two. I connect with lipedema. We have all these maybe palpable nodules, the pain, easily bruising, the cuffing presentation, like all the things there. And we're doing the conservative measures with like compression garments, maybe compression pumps, ruling out what's going on with the veins, like all the things and many more there. But then part of what I teach is manual lymphatic drainage. At the very end of our sequence, we do some deep diaphragmatic breathing. With that good controlled exhale, I often like to incorporate the pelvic floor muscle contraction like a Kegel, right? Turn it on so that contraction acts like a muscle pump for any kind of lymphatic fluid within the pelvis to get pumped away. Well, I can't ask somebody to do a Kegel if they don't know how to do it, if they're not doing it right, or if their muscles are too tight because they're compensating for all the loosey-goosey ligaments and tendons. So oftentimes I'm screening out pelvic health conditions and symptoms with my lipedema clients so that I can treat holistically. So, hey, you know what? Let's check this out to make sure that the pelvic muscles are doing their job, so that way it can help with the lymphatic drainage along the pelvis to continue the conservative management within the lipedema, lymphedema aspect, but also let's make sure we're treating you holistically within your pelvic health. I think pelvic health assessments need to be done, need to be a standard of practice, not only within the peripartum, so pregnancy and postpartum population, and also needs to be a standard of practice within perimenopause and postmenopause population. It needs to be a standard of practice with anyone who identifies as a male or born with a penis, because you also have pelvic floor muscles. It needs to be a standard of practice for all high-level athletes, no matter what gender you are. It needs to be a standard of practice for any kind of trans clients that are transitioning from top or bottom surgery, because there can be some symptoms in the pelvic area with those treatments. It needs to be a standard of practice for anybody who was diagnosed with cancer and going through chemo or radiation, not just in the pelvic area, but even like anywhere in the body, because a lot of those treatments are systemic and they can affect a lot of things. So pelvic health assessments really need to be standard of practice as at least a biannual or annual basis for everyone, and especially as a screening tool to treat holistically for those within the lipedema and lymphedema space, to make sure we're utilizing a major function of the pelvic floor muscles for the lymphatic decongestion. So I hope that helped everybody understand not just my specialties, but you can just tell I'm very passionate about this, but that we really need to make sure we're seeking out holistic care and good quality care. And for those with lipedema or lymphedema or suspecting it, please contact me. I do virtual consultations as well to help with everybody getting access to care, and then helping with that connection with our pelvic health as well. Alrighty, so until next time, y'all.